But now I'll turn over the pulpit, so to speak, or the podium, to Dr. Gary Gunderson to help make visible the invisible, deeply woven roots. Gary.
That was a little dangerous, Sandy, because I actually am a Baptist preacher and I know what to do with a pulpit. Today, I'm trying to stay out of that persona ever so slightly and live into really an extraordinarily honored role, and that is to be here on behalf of the National Academies of Science. And I can't be more grateful, Dean Hill and to Dr. Dillard, for setting the context about why it was so clear for this subject we simply must be on the campus of Shaw University. Couldn't be more appropriate. A National Academies of Science roundtable is designed to open up a subject, not conclude it. And it is very carefully designed for that purpose. And so today, there will be no conclusions. We're not concluding the subject. We're not speaking the definitive word at the intersection of science and faith. But we are opening up what Howard Thurman called holy curiosity. The essence of science are the disciplines of that holy curiosity. And it is why those of us of science, those of us of faith, those of us of both, those of us of some tattered form of both, can find a common space in this space for that discipline of curiosity. We are speaking still in a constitutional democracy, albeit frayed and under stress. Probably not as stressed as when Shaw was formed. So part of the beauty of meeting in this space is actually having a little bit of non-anxious perspective on the stressful journey of living in what could be called a democracy. The first thing to say in this space is that over the past 2.5 centuries, we have found it wise as citizens to keep as much formal distance as possible between the structures of faith and the public structures. And it is still wise to do that. So it's important to say that the deliberations today are not about the public funding of anything religious to do anything religious whatsoever, ever. Today is not about that. No public official, and not many not-for-profit hospital leaders or foundation leaders or other leaders of not-for-profit organizations are considering that or will want to do that for the protection of both the sacred role of faith and, I would say, the sacred role of government. So it is not about whether there are, in faith-based assets, preferential capacities, even ones often mentioned in the literature, such as trust over against public or other private organizations. Today is not about whether one faith has a comparative advantage over another as regards health, although my Adventist friends have to get an edge here for giving holy and cosmic weight to vegetables and nuts. This is not about whether public, private, or faith should be encouraged to act in isolation or preference over against each other. We will open up the field of collaboration. So the sharp focus of today are the arts and crafts of collaborating at the intersection of faith and health in a constitutional democracy that has found it wise to keep at some distance those two very entities. So I'd like to show just 2 slides, if I could. Both of these come from the long-standing work of what was called the Africa Religious Health Assets Program, represented today by Dr. James Cochran. There was in Bing, there we go, the magic of technology. So the program was called Religious Health Assets. And it was called that specifically to slow down our thought process a little bit, to force us to be thoughtful about the mystery between each of those three words, and especially when you put them together. What do we mean by religion? Or I would prefer communities of spirit as they actually exist in the radical diversity of 2018 on the ground of our communities. What do we mean by health? In all of its complex etiology and the layered determinants over a lifespan at population scale. Oh my goodness, if you think you understand that word, you are not paying attention. Bring more holy curiosity to bear on the word health. And today is for the purpose of focusing our curiosity about that third word, asset. What do we mean by an asset that could link those two extraordinary complexities? The genius of this slide, which I happen to know by Jim's report, came to him while in a shower at an academic conference, is very simple. It understands that when we talk about asset in this context, we can see the continuum across a grid, including tangible assets, which is the kind we're most familiar with, but also the extraordinary intangible assets, both of which have proximal effect and distal effects over time and over scale. The longer the scale, the greater the time, the more the intangible assets actually come to bear on producing the outcomes about which we are curious today. So let me slip to the second slide. As a presenter, you'll know neither of these slides is actually intended to be read, but to tease your appetite into the holy curiosity about the subject. This is a radical condensation based on the report from the Africa Religious Health Assets Program to the World Health Organization. And I want you to see the typology, partly to tease us into curiosity about what would be the appropriate typology of understanding the assets relevant to the population scale challenges that we're trying to engage today. So the simple typology breaks what was actually a long list of assets around the questions of prevention, treatment, care and support, and notice an entire asset around the category of linking, the arts of collaboration. So this typology was based on WHO's curiosity about HIV/AIDS at the scale of a continent. But we might bring a similar systematic clarity to what we mean by assets relevant to population health in our view. So both of these help us manage what really are polarities, not just problems. Keep in mind the polarities that help us manage in what really is radical community scale complexity. Call to mind a clinic, a prayer group, a recovery shelter, a needle exchange program, and a Methodist church. These are both tangible and intangible. They have effects that are both proximate and distal. But thirdly, consider the polarity managed by who owns or influences that asset. Who owns or influences that asset toward the optimal alignment with other equally complex relevant assets to the health of the people. This maps a complex phenomenon in a complex living system called population. Revelations 21 says that the leaves on the tree of life, let us call them health assets, are for the life of the whole people, the whole population. This day is for opening our eyes and minds so that we might see. We will help each other, some of us with prepared roles on this side of the microphone, but all of us in the room active and engaged with each other. Some, like Dr. Cochran, Dr. Shoma Stout, Counselor Gene Matthews, are on the participant side of the microphone at the moment. Dr. John Hatch, the author of much of this body of work, is with us today. So there's an extraordinary richness in the room. And the workshop is designed not just to hear presentations, but to provoke enough curiosity that we can engage with each other so that together we might see together. Don't hold yourself back. Come into this open and holy space.